Mr. X, case analysis, a BS Ed Biology irregular student, 9 years old, single, was counseled last December 14, 2023 at 3:30 p.m. He felt stressed and depressed due to his tuberculosis diagnosis. That Mr. X's tuberculosis diagnosis affected the following. His physical and mental health were affected. He stopped schooling for 3 months due to his medication. He became an irregular student, thus mitigating his stress in coping the difficult subjects in biology. Mr. X wanted to become a professional biology teacher in the future. He has a very supportive family who took care and provided his physical and mental needs during his tuberculosis medication. This is a case of a student named Mr. X who was full of goals in his life during his childhood days. He had to stop within 3 months. He experienced mental and physical health problems. According to him, his stay at home made him realize if he is ready to face the world. After that treatment, he confronted educational challenges like becoming an irregular student, difficulty in coping to some of his major subjects in biology. He is now enrolled and confronting the challenges positively to attain his ambition for his family. This case study aims to answer the following questions. What counseling goals can best assist the clients in achieving a greater degree of independence and integration so he can cope better with problems being identified in the case analysis? How to address the problems by applying the therapeutic core conditions between the counselee and the student intern under the person-centered therapy. This case analysis will be using the human existentialism theory, the person-centered therapy approach developed by Dr. Carl Rogers. These were the results of Mr. X's progress as a counselee in the person-centered therapy. According to him, he is now ready to face the world and currently enrolled at PNU as PS Ed Biology major. Though an irregular student, he is now ready to cope with the difficult subjects in his major. His experiences made him realize that his existence as a person has its essence, and that is the concept of humanism existentialism. That having a very supportive family played a vital role in his physical and mental health, and that the essence of life will depend on his positive perception. The case of Mr. X is an example of person-centered therapy. Based on his experiences narration during the counseling session, he was diagnosed of tuberculosis illness and had a great impact on his physical and mental health. Through the conduct of counseling services last December 14, 2023 at 3:30 in the afternoon, the counselor intern was able to detect the issues or the problems being experienced by the student. The recommendations are the following. Based on the case analysis of Mr. X, the following were recommended. That a preparation of the subject's case history must first be considered before performing any counseling. That the therapy must be applied based on the client's history or experiences. That in counseling goals, there must be a systematic application of therapeutic core conditions. That there must be a good relationship between the counselee and the counselor in turn. And lastly, that there must be an equality and empathy during the session.